and welcome to Choosing a Medicare Supplement or Medigap policy sponsored by Hoag Hospital and the Hoag Medical Group. The Hoag Medical Group and Hoag Physician Partners are an excellent team of doctors that provide internal medicine, family practitioners, doctors of osteopath, and they have a list of specialists of over 350 that will treat your specialties. And my name is Derek Tarvin, and I've had the honor and privilege of working with Hoag Hospital as an outside insurance consultant for over 26 years. We have a family agency. I work with my mom, Sue Tarvin, my niece, Julia Ferrara, and we help counsel everybody on Medicare, Medicare options, the Medicare supplements, the Medicare Advantage plans, and the Part D drug plans. But today we'll be specifically focusing on the Medicare supplements and Medicare and the Part D drug coverage and the various enrollment timeframes. So today we'll be going over what is Medicare, signing up for Medicare, Medicare supplements, also known as Medigap plans, they're synonymous. The Medicare Part D prescription drug plans that one would purchase that go along with a Medicare supplement plan, extra help, and different open enrollment periods for signing up for supplemental plans. So first of all, what is Medicare? Medicare, also called Original Medicare, is health insurance for persons that are age 65 or older, or those that are under age 65 and have received disability benefits for 24 months, or any age persons that have end-stage renal disease or Lou Gehrig's disease. Medicare has 4 different parts. Part A is the inpatient covered services. Part B is where all your medical and outpatient services fall under. Part C is what's considered the Medicare Advantage HMO or Medicare Advantage PPO. And then Part D is considered the prescription drug coverage. And only Medicare Parts A and Parts B will appear on your red, white, and blue Medicare card that you'll receive in the mail once you enroll into Medicare. And an example of the card you'll receive is on your screen for you. So Medicare Part A, this is your inpatient services, and most do not pay a premium for Part A of Medicare. It was paid by you or a spouse through payroll taxes while working. As long as one's contributed 40 quarters, that qualifies for premium-free Part A of Medicare. And Part A of Medicare, it helps cover inpatient covered services in hospitals, skilled leveling nursing care in nursing facilities, hospice, and very limited part-time medically necessary home health care. Part B of Medicare is where all your medical services and the outpatient services fall under. Most people do pay a premium for Part B of Medicare. This year, the standard premium for Part B of Medicare is $148.50 per month, but it can be more than that based upon one's income. The premium for Medicare is deducted from your Social Security benefits if you're drawing it. Otherwise, you receive a bill in the mail, quarterly bill to pay your Medicare premiums until if and when you start receiving Social Security. And then at that time, they'll automatically start drafting your Medicare premiums from your Social Security benefits or income. Part B of Medicare, it helps cover your medically necessary doctor services, outpatient care, tests, durable medical equipment, very limited home health care, preventive services, and more. Those that are higher income Medicare beneficiaries will pay more for your Part B of Medicare. The way that they determine your Medicare premiums is that Social Security looks at your tax returns on your modified adjusted gross, and they always look back 2 years. So for the year 21, they look at your 19 tax return to determine what your Medicare premiums are. And those that file an individual tax return and it was less than $88,000, they'll pay the standard Medicare Part B premium. Those that file a joint tax return and is less than $176 in 2019 on your modified adjusted gross will pay the standard Medicare premium of $148.50 per month. Those that are higher than those figures will pay more based on your income. It's called IRMA, or an income-related monthly adjustment amount. And the amounts that one can pay based upon your higher income are on the screen for you to study, and it can go as high as this next screen. Obviously, if someone's working 2 years ago, or you cash in an annuity or sell a property, and your income is much higher than when you're on Medicare and they're charging you that income-related monthly adjustment amount, and your income has gone down, give Social Security a call and discuss your current financial status, and they most likely will lower your Medicare premiums based on your current financial status. Otherwise, they audit your Medicare premiums, and it can go up or down based upon your filings each year. So signing up for Medicare. Medicare usually starts on the first day of the month that you turn age 65. If your birthday falls on the 1st, they actually backdate it a month. But typically, your Medicare eligibility is the first day of the month that you turn age 65. If you're receiving Social Security or railroad retirement benefits, you'll automatically get your card in the mail 3 months before you turn 65 or the 25th month of receiving disability benefits. If you're in these situations and you do not receive your Medicare card in the mail, give Social Security a call. And the number is on the screen. And right now they're open Monday through Friday, 8 to 7. And unfortunately, if you call them now, they're extremely busy. And it may be a very long wait time. So you may want to call them like a Wednesday or Thursday, first thing in the morning or very late in the afternoon. But hang in there, you'll get through to them. I would recommend, if you're going to call Social Security, call your local Social Security office, and it's typically a lower wait time than you see this number on the screen, which is the main number. So if you're not receiving Social Security or railroad retirement benefits when you become eligible for Medicare, you must sign up with Social Security to get your Medicare card. And to do that, there's a few different ways you can do that. You can call Social Security to enroll, and they'll set up a future telephone appointment over you for the phone, or you can enroll online. And if you go to ssa.gov, you'll find a link that will take you to Medicare's website, and then you can enroll that way. So there's an initial enrollment period for signing up for Medicare. You can sign up for Medicare 3 months before the month you turn age 65, which includes your birthday month, or up to 3 months after your birthday month. If you sign up within 3 months before your birthday month, Medicare will start the first day of your eligibility for Medicare. If you sign up during your birthday month or within 3 months after your birthday month, Medicare will start 1 to 3 months after signing up. There is a general enrollment period for those that have missed their initial enrollment period, and this occurs every January 1st to March 31st. If you sign up during this time frame, Medicare will start July 1st, and you may incur a late enrollment penalty. There are special enrollment periods for signing up to Medicare, those that are covered by employer group plans. If you are covered by an employer-sponsored group health plan and it's based on current employment and there's more than 20 employees, you can actually delay signing up for Medicare Parts A and or Part B with no penalty. However, whichever happens first, if employment ends or group insurance ends, whichever happens first, you have 8 months to sign up for Medicare Parts A and or Part B with no penalty. And always check with your group plan or your benefits advisor to see how Medicare coordinates with your group insurance. But typically, if there's more than 20 employees, you're covered under the group insurance, still actively employed. Medicare is not primary, and you can delay Medicare Parts A and or Part B and sign up in the future with no penalty. Most people that have group insurance, there's more than 20 employees and are eligible for Medicare, you can sign up for Part A of Medicare and delay Part B of Medicare. It's really just a formality because it's not going to coordinate with your group insurance. But if you're eligible for Medicare, covered under group insurance, there's more than 20 employees, you can go ahead and sign up for Part A of Medicare and definitely delay Part B of Medicare because you don't want to pay that premium for no reason. So those that do enroll in a Part A of Medicare and delay Part B of Medicare, and then later on you want to enroll in a Part B of Medicare, you will not have a penalty as long as you're currently working and there's more than 20 employees. But again, whatever happens first, if employment terminates or group insurance terminates, make sure you enroll into Medicare within 8 months so you will not accrue any penalty. Most people are going to coordinate your Medicare to start the day after your group insurance ends, but you do have that window to enroll. in case you missed that initial window of when your group insurance terminates. So those that have Part A of Medicare, and then in the future you do need to enroll into Part B of Medicare, there'll be two forms to complete. One you would fill out, one you and your employer fill out, and you submit those to Social Security, and they enroll you into Part B when such time is necessary. We have those forms in our office. We can email those to you, or you can get those online through Social Security. But again, those that have Medicare Part A and need to enroll into Part B when such time is necessary, again, those two forms will need to be filled out. One you fill out, one you and your employer fill out. You submit those to Social Security, and they enroll into Part B when such time is necessary. So those that have a health savings account contribution and are still currently employed under the group insurance, most of the time you'll want to delay signing up for Part A and definitely signing up for Part B. If you're eligible for Medicare, still currently employed, more than 20 employees, and you have a health savings account contribution or health savings account, you'll want to delay Medicare Parts A and or Part B because it can have some tax implications. But again, always check with your benefits advisor or human resource to see how Medicare will coordinate with your group insurance. If there's no health savings account contribution and you're currently employed, eligible for Medicare, there's more than 20 employees, you can go ahead and sign up for Part A. But if there's a health savings account contribution, I would delay Part A and Part B until the group insurance terminates or the employment terminates. It's not a slide on there, but typically if there's less than 20 employees and you're currently employed, covered in group insurance, usually Medicare becomes primary, and you'll need to enroll in the Medicare Parts A and Parts B if you're currently employed, covered in the group insurance, and there's less than 20 employees. There's exceptions to every rule, so always check with your benefits advisor or human resource, but that's the typical rule of thumb, is if there's less than 20 employees, you're eligible for Medicare, still currently employed under the group insurance, Medicare becomes primary, and you would want to enroll into Medicare A and B. If there's more than 20 employees, still employed, cover the group insurance, you can delay Medicare A and or Part B with no penalty in the future. So COBRA, this is kind of a tricky one. COBRA is a continuation of group insurance once employment has terminated. And COBRA is an extension of your current insurance through your employer, but you have terminated the insurance, not terminated the insurance, but the employment is terminated. And COBRA can be applied for a period of 18 months up to sometimes 36 months. And employment is terminated, so if you're eligible for Medicare and receiving COBRA, make sure you enroll into Medicare within 8 months, even though the group insurance COBRA can carry you for 18 months because it's one of those two criteria. Group insurance is terminated or employment is terminated. And even though COBRA is an extension of your group insurance, employment is terminated, and make sure you enroll into Medicare within 8 months so you do not get penalized. And always check out what the premiums are for COBRA versus individual insurance for Medicare, because COBRA can be very expensive, and we can help you do that. We review people's group insurance and compare that to individual insurance through Medicare. And it may be much more cost effective to go on an individual plan versus COBRA. Sometimes people may have a spouse that's under 65 that is covered under COBRA, and you may want to stick with COBRA in that instance because individual insurance under 65 is very expensive. So we can definitely help that with you. We counsel everybody on Medicare. We can review your group coverage and then the various plans, and we don't ever charge a fee. But if you're receiving COBRA, eligible for Medicare, check out the premiums, the coverage, and compare that to individual Medicare coverage. So now we're going to discuss the Medicare Supplement plans, also known as Medigap. It's synonymous. The plans can range from plans A as in Apple through N as in Nancy. They're all denoted by letters. The Medicare Supplement plans or Medigap plans supplement original Medicare and pay secondary to Medicare. With the Medicare Supplements or Medigap, your original Medicare Parts A and B is primary, and the Medicare Supplement plans are secondary. With the Medicare Supplements or Medigap plans, you can choose any doctor, any specialist, any hospital facility nationwide that accepts Medicare patients. Referrals are not required to see specialists, and prior authorizations and approvals are not required. The Medicare Supplements, also known as Medigap, plans A through N are all standardized Medicare Supplement plans that are sold by various insurance companies. So with the Medicare Supplement plans, any companies that offer the same plans like Plan F or Plan G, the medical benefits are identical. You can access all the same doctors, and they all pay the same claims. It's just different companies will charge you different rates for the same standardized Medicare Supplement plans. And we just market or recommend the company that's got the lower premium for the Medicare Supplement plans because they're all standardized Medicare Supplement plans. Any doctor, any facility, any specialist or hospital that takes Medicare will take any supplementing company. And when you have a Medicare supplement, when you go to make an appointment, you don't ask, do you take Anthem, Blue Shield, Health Net, United Healthcare, etc. It's just, do you take Medicare patients? If they do, they take any supplementing company, and they all pay the same as far as the medical claims with that particular plan. So, as I mentioned, the different companies will charge different premiums for the same standardized Medicare Supplements or Medigap plans. You do pay a monthly premium for the Medicare Supplements on top of what you pay for your Part B of Medicare, and you also are enrolled in Medicare Part A. The Medicare Supplement plans or Medigap plans are guaranteed renewable for life. The benefits for the plans can never be changed, and the policies cannot be canceled other than non-payment of premiums. So the benefits for the Medicare Supplements can never be changed. They can't cancel you other than non-payment of premiums. It's just unfortunately the premiums do go up with attained age. And you're not locked into any Medicare Supplement plan or company for life, and we'll get into that scenarios in a few slides from now. So on your screen, there is an example of the Medicare Supplement comparison chart that we put out through our office and through Hogue. If you can print out this screen, and if you do, you'll want to put these two pages together. Or we could email you the brochure. Hogue can email that to you, or we can send that to you from our office as well. On the left of the screen are your two parts for Original Medicare. And Original Medicare, it has certain deductibles, co-payments, and co-insurance that it doesn't cover. And the Medicare Supplement plans or Medigap plans are there to help offset of what Medicare doesn't cover. And the various Medicare Supplement plans for comparison are on your screen and here. So on the top of the screen are the various Medicare Supplement plans for comparison. And again, on the left is what Original Medicare benefits are and what they don't cover. So if you look at the top of your left hand of your screen under Part A of Medicare, if you're hospitalized, there's a deductible that Part A of Medicare requires of $1,484. And currently, the most popular plans, the ones that give you full coverage, is considered Plan F as in Frank. There's two variants of Plan F. There is the traditional Plan F, and then there's what they call an extra or innovative Plan F. They have the same medical coverage, the same doctor access, and the same claims payment. It's just with the extra or innovative F, it has routine vision and hearing benefits that traditional F doesn't cover. And on the bottom right of the chart, those that are new to Medicare Part A as of January 1st, 2020 or beyond are not eligible for Plan F, unfortunately, or any Plan F, or Plan C. If your Medicare Part A has started before that, you still are eligible for Plan F, or if you have Plan F, you can switch to a different Plan F. But don't worry if you cannot enroll into Plan F. There is Plan G, which is right next to it on the top of the chart on the right. It's almost identical to Plan F, and we'll go over what those benefits are. And there's two variants of Plan G as well. There is the traditional Plan G, and then there is an extra or innovative Plan G. Only Blue Shield of California currently offers an extra G, and Health Net of California offers the innovative Plan G. Again, they have the same medical coverage, same doctor access, and same claims payment. It's just with the extra G and innovative G, they offer routine vision benefits, hearing aid, and the extra G offers an over-the-counter benefit where they give you a $100 benefit towards over-the-counter items as a mail-order program. There's a catalog you can choose, and there's like 11 pages of items you can choose from, like allergy medication, sunscreen, bandages, vitamins, toothpaste, etc. So we're going to go over what Medicare covers on the left, and then we'll go over Plan F and the Plan Gs. So again, if you're hospitalized as an inpatient, your Part A of Medicare is going to cover everything except that hospital deductible of $1,484. And if you follow the chart over, Plan Fs or the Plan Gs cover that Part A deductible each and every time. That Part A hospital deductible could be met more than once in a calendar year. If you're admitted to the hospital and then you're released, and you're out of the hospital for a period of 60 consecutive days or more than readmitted, then Medicare requires the deductible new benefit period, as they call it. But the supplemental Plans F or Plan G will cover that deductible each and every time, so you don't have to worry about it. Besides inpatient hospitalizations under Part A of Medicare, fall skilled nurse facilities. If you're hospitalized for a period of 3 days or more, and then you're released and you're admitted to a skilled nurse facility, Medicare covers the first 20 days 100%. Days 21 through 100, Medicare covers everything but a copayment of $185.50 per day. And if you follow the chart over to the right, Plan Fs and the Plan Gs pick up those skilled nursing days for 21 through 100. And if you're released from a skilled nurse facility and you're out of the skilled nurse facility for 60 consecutive days or more than readmitted, those 100 days will start over. And then on the left of the chart, under hospice care, Plan F and Plan Gs cover any Medicare charges for hospice 100%. The chart doesn't show it, but Medicare will cover some at-home skilled nursing benefits, but it's very limited, but it's not on your chart there. So even if you're in the hospital or skilled nurse facility, any of your outpatient charges will always fall under Part B of Medicare. Part B of Medicare covers all your doctor visits, specialists, lab, x-ray, diagnostics, MRIs, PET scans, CAT scan, chemotherapy, radiation therapy, dialysis, ambulance, ER, your surgeons, assistant surgeons, anesthesiologists, radiologists, pathologists, your outpatient occupational physical speech therapy, doctor visits in the hospital, outpatient surgeries, durable medical equipment, preventative services, or medications that are administered in a facility by a provider fall under Part B of Medicare. It's just the drugs that fill the pharmacy or mail order on the bottom left of your chart fall under a separate Part D drug plan that you have to purchase that we'll talk about later on in the presentation. So under Part B on the left of your chart, Medicare covers 80% of the Medicare approved amount. The providers always bill one amount. They send the claim off to Medicare, and for your Medicare approved charge, Medicare usually lowers that fee and sets an approved amount. And Medicare Part B covers 80% of that. And they follow the chart to the right, Plan Fs and the Plan Gs cover the remaining 20%, 100%. And underneath the 20% to the right, Plan Fs and Plan G also cover what they consider excess charges 100%. And what they mean by excess charges is any providers that take Medicare, they may or may not take what's called assignment. So the providers that take Medicare, that accept assignment, they will not charge above what Medicare approves. They take that as payment in full. But if the providers want to get paid a little bit more than what Medicare approves, it's on the bottom left of your chart under Part B. So those doctors or providers that take Medicare that don't take assignment, they'll charge 15% above what Medicare approves. And that amount that providers charge above what Medicare approves, if they don't take assignment, is called excess charges. But you don't have to worry about those because Plan F and the Plan Gs cover the excess charge 100%. And currently with Plan F, it pays the Part B annual deductible that Medicare requires. Part B requires a nominal deductible each year. This year is $203. That Plan F pays, and Plan G, you pay that. That's the only difference in the medical benefits, is Plan F pays that nominal deductible, and Plan G, you pay that deductible. And currently, with the premiums, Plan G is still going to be more cost effective, even if you're eligible for it, incorporating paying that deductible. I believe next year that deductible, not I believe, but it creeps up a little bit each year. Last year, that deductible was $198. The year before that, it was like $184. And before that, it was like $167. So it creeps up a little bit each year, but not much. Next year, I believe that Part B deductible is going to be $217. That's not set in stone yet, but I believe that's what it's going to be. So it's not going up much if you do have to pay it. So with Plan F, it's full coverage between your Medicare A being primary and Plan F being secondary. The Plan G's, either variation, it's almost full coverage. You just have that minor deductible of $203. And then once that deductible is met, you're covered 100% for a Medicare approved charge this year. Medicare itself, down to the bottom left of your chart under other benefits, does not cover foreign travel. If you follow the chart over, it says yes under Plan F or Plan G. And the foreign travel is not highlighted on the chart. It's limited, but for foreign travel, you actually pay it time of submission in the foreign country. And then when you get back to the United States, we would file a claim with the insurance company. And for foreign travel, there's a $250 deductible, and the plan covers 80% up to $50,000 lifetime outside the United States. So there's limited coverage, and there's some, but we would still recommend additional travel insurance, because that would cover your medical service up to a point, but it wouldn't cover your Medivac flight home to the United States. So you want to self-insure for that outside the United States. But inside the United States, with the Medicare Supplement plans or Medigap, there's no limit to the amount of claims. And as we mentioned, the policies are guaranteed renewable for life. They can never change the benefits or cancel it other than non-payment of premium. So again, the two variations of Plan F are identical in the medical coverage. This claims payment and the doctor access is just with the extra F or innovative F. It has routine vision for optometry and a glass or contact benefit, and a benefit for hearing exams and a copay for hearing aids. And the extra G is the same medical benefits as the traditional G. It's just with the extra G and the innovative G, it has routine benefits for optometry, a benefit towards eyewear for glasses or contacts, and the extra G also gives the over-the-counter benefit for over-the-counter items. So that's basically the Medicare supplement plans. The other plans, no one really enrolls in. Logic dictates that K, L, and N would have higher coverage, but they don't. Plan A is the lowest coverage. I haven't enrolled anybody in a Plan A in 20 years. Most people, if they're eligible, may enroll in Plan F or Plan G, but those are the two plans that most people enroll in, have the highest coverage, and the ones that we would recommend. So that is the supplemental plans, and we'll be taking questions on the supplemental plans a little bit later in the presentation. So now we're going to move on. And if you do need a copy of this chart, we can email it to you, you can print it out, or we can mail it by regular mail to you. So as we mentioned, some companies will offer Plan F or the extra or innovative F. And we kind of went over those. The Plan F and Extra F or Innovative have identical medical coverage. It's just the Innovative or Extra F has routine vision and hearing benefits. And the G, the traditional G and the Extra or Innovative G have identical medical coverage. It's just with the Extra G and the Innovative G, it has routine vision coverage, and hearing aid benefit and hearing exam coverage. And the Extra G also includes the over-the-counter OTC benefits. So now we're going to discuss the Part D prescription drug coverage. Medicare Part D drug coverage is available to anyone that has Medicare Parts A and or Part B. So those that have original Medicare and a Medicare supplement, you must purchase a standalone Part D drug plan for your prescriptions you fill at mail order or to the pharmacy. Medicare, again, will cover prescriptions that are administered in a facility by a provider, but the drugs that you fill at the pharmacy or mail order always fall under a separate Part D drug plan. And as I mentioned, if you have a Medicare Supplement Medigap, you'll want to purchase a standalone Part D drug plan. And they are sold by various companies that are approved by Medicare. Unfortunately, those that have higher income that pay more for your Part B, you will also pay more for your Part D drug coverage. They shake the trees any way they can. So if you do have an income-related monthly adjustment amount and they're charging you more for your Medicare Part B, they will charge you more for your Part D drug plan based on your income from 2 years ago. And the amounts that you can pay are on your screen, and they can go as high as this on the bottom of your screen. And these amounts change each year, and they will go up for next year, unfortunately. But again, 2 years ago, if your income was lower and they're charging you an IRMA, income-related monthly adjustment amount for Part B as in boy and Part D, give Social Security a call, discuss your current financial status with them, and they most likely will lower your Medicare premiums based on your current status. Otherwise, they'll audit it every single year automatically. There is a Part D late enrollment penalty. If you delay enrolling into Part D or have a break in continuous coverage for 63 days or more and you don't have other creditable coverage or extra help, when you enroll, a late enrollment penalty will be added to your Part D premium for life. It's not a huge penalty, it's more of a nuisance. The penalty is on the bottom of your screen there. The penalty is 1% of the national average base premium, which is multiplied by the number of uncovered months. I believe the national average base premium is around $35. So if you went, say, 24 months without a drug plan or a break in coverage and they penalize you, I think 24% of $35 is like $8.40, around there. And that'll be tacked on to your premium for life. It's not big, but it does accrue each year. And it's a good idea to have a drug plan just in case you need it and don't get penalized later on for enrolling late. Those that have extra help is a program for people with limited income and resources that can help pay for your Medicare drug costs called Limited Income Subsidy, LIS. And it can help pay monthly plan premiums, deductibles, co-insurance, or co-payments. If you think you qualify, give Social Security a call and discuss your current financial status with them and see if you qualify for extra help. So we're not going to get in too much into the different enrollment scenario, how Part D drug plans work. It's very confusing. But if you have any questions regarding Part D, please give us a call or an email. We'll be glad to get in depth with you. This year, there's 32 different Part D drug plans you can choose from. Each company has different premiums, different formularies, different co-payments for the medications. How we make a recommendation for a drug plan is based on your current medications. We can input your medications and we get a line-by-line itemization of all the drug plans, and it lists them from which drug plan is least out-of-pocket annually to which is highest. And that's how we make a recommendation based on your drugs. If someone's not taking medications, we just recommend the lower cost premium drug plan so you have the coverage in case you need it. And unfortunately, the drug plans change every single year. And whatever drug plan is cost effective one year may not be next year, whether your medications change or not. And we get real busy during this time frame called the annual enrollment period. It occurs between October 15th and December 7th. This does not apply to Medicare supplement plans. This enrollment period that we're in now applies to the Part D drug plans or Advantage plans, which we're not discussing today. But if you have a Part D drug plan, we would highly recommend reviewing them or having us review them, because the drug coverage, whether your medications change or not, they change drastically every single year. Next year, there's 25 drug plans, and whatever drug plan is cost effective next year may not be next year. So now we're going to start to discuss the different Medicare Supplement or Medigap enrollment periods, open enrollment periods where you do not have to answer health questions to be eligible for the coverage. So those that are turning 65 are new to Medicare and are enrolling into a Medicare supplement plan, you have guaranteed issue. They do not ask any health questions or underwriting for 3 months before your eligibility of your Part B of Medicare or up to 6 months after your Part B starts to enroll into a Medicare Supplement plan. So to be eligible to enroll into a Medicare Supplement Medigap, you must be enrolled in Part A, have Part B, and paying your Part B premiums, and you have 3 months before your effective date of Medicare goes into effect, up to 6 months after your Part B starts to enroll into a Medicare Supplement plan with no health questions. And special rules apply for those that have end-stage renal disease. There's other enrollment periods besides being new to Medicare Part B. Those that are leaving employer-sponsored group health coverage, whether your Medicare A and B has been in effect for years, you have a guaranteed issue with no health questions. Once group insurance terminates, of 63 days to enroll into a Medicare Supplement plan with no health questions. So let's say you have a group-sponsored health plan, whether you're employed or it's COBRA. Once that plan terminates, if your Medicare A and B has been in effect for some time, you have 63 days to enroll into a Medicare Supplement plan with no health questions. If you're new to Part B of Medicare, you have that 6-month window. Most people are going to coordinate their Medicare supplement to start the day after your group insurance terminates, or COBRA, which is extension of group insurance. But if you miss that window, you do have these dates to enroll without having to answer any health questions, because they could deny you if you don't have a guaranteed issue scenario. There's 17 different guaranteed issue scenarios for the Medicare supplement plans. They don't all apply. We're going over the major ones today, but there are other ones that may apply. So if you have some questions about them, give us a call or shoot us an email and we can discuss your situations with them. So this is a pretty popular one. Again, as I mentioned earlier, you're not locked into any Medicare supplement plan or company for life. If you have a Medicare supplement plan and you have health conditions or later on develop them, and company Z has a more attractive premium for the same coverage, every year on your birthday, you have a period of 30 days before your birthday, up to 60 days after, to where you can switch your Medicare supplement to the same company or a different company that has equal or lesser coverage and no health questions. And this occurs every birthday anniversary. The Medicare supplement plans don't change that drastically, like the Part D drug coverage changes drastically every year. Every few years, a good idea to look at the Medicare supplement premiums. And if another company or the same company has a better premium for similar coverage, you can change during your birthday every year without any health questions, a period of 30 days before your birthday, up to 6 days after. So it's a good idea to check out the premiums for the Medicare gaps or Medicare Supplements and Medigaps every so often. And this one's pretty popular too. This is a 12-month trial right. Those that are turning 65 and enroll into a Medicare Advantage HMO or Medicare Advantage PPO, you have 12 months to try the Advantage plan out. If for any reason you're not happy with the Advantage plan during the initial 12 months, or you simply want to get a Medicare supplement plan for whatever reason, you can terminate your Advantage plan at any time during the initial 12 months and enroll into a Medicare supplement and a drug plan with no health questions. Those that have a Medicare supplement plan and you're like, the premiums are cost prohibitive and the Advantage plans look attractive, which they do, anybody who enrolls into a Medicare Advantage plan for the very first time coming out of a Medicare supplement plan, they will give you a 12-month trial basis to try the Advantage plan out. If for any reason during the initial 12 months you're not happy with the Advantage plan or simply want to get your Medicare supplement back, you can do so anytime during the initial 12 months with no health questions, get your Medicare supplement back and a drug plan within that 12 months. If you stay with the Advantage plan past that initial 12 months, they're going to lock into that Advantage plan for that calendar year, and you may be subject to health questions later on in the future. There is another enrollment period, not too many people know about this one. It's a Medicare Advantage open enrollment period. This applies to people that have Medicare Advantage plans. During this time frame between January 1st and March 31st, you can disenroll from Medicare Advantage plan and return back to original Medicare. Because if you have an Advantage plan, your Medicare A and B you still have is still in force, but it's signed over to the Advantage plan and you're not going by original Medicare benefits. So with a supplemental plan, Medicare's primary and the supplements are secondary. And during this time frame, if you have a Medicare Advantage plan, you can disenroll from a Medicare Advantage plan and apply for a Medicare Supplement plan and enroll into a Part D drug plan. If you're going to use this scenario, we highly advise applying for the Medicare Supplement first, because they may deny your coverage based on health if you don't have another guaranteed issue scenario. This is not a guaranteed issue scenario. And if you enroll into a Part D drug plan before the supplemental plan approves you, the Part D drug plan is going to terminate your Advantage plan automatically the next month, and we don't ever want to leave anybody out of insurance. So if, again, you have a Medicare Advantage plan and you would like to disenroll from the Advantage plan during this time frame and apply for a Medicare Supplement, we highly advise enrolling into the Medicare Supplement plan. Make sure you get issued and approved first, and then enroll into a drug plan, because again, we don't ever want to leave anybody out of insurance. And if you enroll in the Medicare Supplement plan and a drug plan, they're going to cancel your Advantage plan out the next month, and if they deny you for your Medicare Supplement, you're without coverage. So we don't ever want that to happen. So again, make sure you apply for the Medicare Supplement plan first. Do not enroll into a Part D drug plan until you hear from the supplemental plan that you've been approved, and then enroll into a Part D drug plan. There is another guaranteed issue scenario that is not on the slides. That's one of the 17. If you move, you've got a guaranteed issue scenario. If you move out of the county or state to whatever plans offered in that area, whether it's a Medicare Supplement or a Medicare Advantage plan. We do have clients that have moved to other states that have kept their coverage from California. If you do move to a different state, I advise seeing what the plans are out there. If the Medicare Supplement plan benefits are similar and the premiums are lower, go ahead and switch to that plan in that area, move to outside California. If it's cheaper, definitely enroll into that plan outside California, and you have guaranteed issue to make that change. So now we're going to take questions. We're going to field your questions. If you have any more questions in the future, our information is down on the bottom of the screen. We have a family business. We don't ever charge a fee for consultation, and we can help you in any aspects of Medicare and Medicare options. So, do we have no questions? Well, you must be a very attentive audience today. Well, we appreciate you joining. If you do have any questions, you can email them to Hogue, or please give me a call or email me, and the information is on the bottom of the screen. We thank you so much for attending. And do we have one question? Oh, yeah, we do. Thank you.
I'm just going to read it out.
Sure.
It says, so that I am clear, the standardized coverage for supplement plans is the same for next year as this one?
The question is the Medicare Supplement coverage the same for this year and next year? Yeah, it is. Any company that offers Plan F or Plan G, the benefits are always identical. And the benefits can never change of the Medicare Supplement plans. The only variant is how much they charge you for the plans, or if they have the extra benefits like the Innovative or Extra Plan F or Innovative or Extra Plan G. The medical benefits are identical and they're standardized. They're federal law. They can never, ever change the benefits year to year, and they can never cancel you if you're in the plan unless you don't pay your premiums. But yeah, that's a good question, but no, they can never change. Yeah, but thank you. All right, well, thank you so much for attending. And again, please contact us if you have any questions, and we'd love to hear from you. And you guys have a great afternoon. Thank you so much.